US President Donald Trump could be discharged from hospital within 24 hours. Doctors who have been treating him for COVID-19 say his health is improving. At the same time, though, some experts are warning that the president's infection may be more severe than the diagnosis that's been made public. Mr. Trump received extra oxygen after his blood oxygen levels dipped twice over the weekend. He was also given the steroid dexamethasone, which is normally reserved for serious cases. Mr. Trump, though, has been eager to show he's doing well. He's ventured out in a motorcade to greet supporters who'd gathered outside the hospital. The president also posted a video on Twitter to reassure the public that he is recovering.
It's been a very interesting journey. I learned a lot about COVID. I learned it by really going to school. This is the real school. This isn't the let's read the book school. And I get it, and I understand it. And it's a very interesting thing, and I'm going to be letting you know about it.
And Simon Marks joins us from Washington, D.C. now. Simon, what's the latest on Mr. Trump's condition? Is he likely to be discharged today?
Well, it's looking as though it's possible, Glenda. We've just heard from the White House Chief of Staff, Mark Meadows, and I think we have to caveat all of this by saying that the weekend witnessed, even for this White House, a stunning degree of misleading information being put into the public domain about the president's condition, about the treatment that he was receiving. So it is very hard to accept all of this at face value. But the White House Chief of Staff, Mark Meadows, has just told NBC News the discharge decision will be made later today between the president and his medical team, a turn of phrase that is raising some eyebrows here. It suggests that the president is going to be an active participant in determining the outcome of that particular conversation. It's perfectly possible that he's going to return to the White House. We don't know if he returns to the White House whether he's going to agree to go into isolation and to quarantine, or whether he intends merely to continue going back to his daily activities even while he is still at substantial risk of infecting other people with COVID-19. Those people, of course, include the staff and Secret Service agents who were with him in that ride-by last night as he waved at supporters who had gathered outside Walter Reed Medical Center. The Secret Service now says that the staff that travelled with the president will be placed into quarantine. They will not say how many Secret Service staff may have tested positive for COVID-19. They say they don't put that information out publicly, but certainly any Secret Service personnel involved in that motorcade last night will now be going into 2 weeks of isolation. And this, of course, that ride-by came moments after the president issued that video saying of COVID-19, "I get it." Well, public health officials at the very medical centre where he's being treated say that he doesn't get it at all. One attending physician there described the president's decision to leave the hospital and get into the SUV as, and this is a quote, insanity.
It does seem like a strange decision given what we know about COVID-19, Simon. But Mr. Trump's illness, it has put a stop to his campaigning for now, at least, something he'll be keen to get back to. What's the plan for the Trump campaign with less than a month before the election?
Well, I think you could argue, Steve, it hasn't entirely put a stop to his campaigning. He's been on Twitter this morning relentlessly campaigning, all in block capitals, a whole series of messages reminding voters of issues on which he believes he has a strong record and encouraging them to get out and vote. He's clearly itching for the opportunity, as he said in a video released on Saturday, to return to the fray so that he can continue the task of making America great again, as he put it. We know that Vice President Mike Pence has been tapped to fill in for the president at one rally later this week, I think on Thursday night here in the United States. But look, the unpredictability of his behavior, even now that he has tested positive for COVID-19 and continues to be a risk of infecting other people, means that we have no idea just how soon he plans to return to the rally stage and how soon he plans to continue battling for 4 more years in the Oval Office in person. I mean, there's another presidential debate still notionally on the books for October the 15th. It would seem inconceivable that that can take place because it's within the 2-week window of the president's positive test result coming back. But at this point, the inconceivable in this country often becomes the inevitable. So I'm not really sure where we all go from here.
All right, well, we're all in this together. Thanks very much for that. Simon Marks reporting to us from Washington, D.C.